Heart disease is the leading cause of death for women in the United States. And seeing as February is National Heart Health Month, we're taking a look at how you can keep your heart healthy. Alexis Robinson reports.
The main room of the Parkersburg Clubhouse was filled with hundreds of women wearing red Friday as they met for a luncheon held by Camden Clark Medical Center in support of National Heart Health Month. One of the many guest speakers at the event was Monica Davis, a Franklin Elementary School teacher who fell to the floor last year in the middle of class with a heart episode.
I just remember talking to those students and thanking them for doing a better job, and then I literally dropped without a pulse.
Officials with the school saw Monica collapse and immediately started performing CPR. Monica said if it weren't for the quick action and the help of the AED, she might not be here today.
I am so grateful for the organizations, the nonprofits, and that put the AEDs in our schools. And I encourage anyone who is working with any group or organization, if they decide they want an AED because there are so many people gathered, please do all you can to get that AED there.
Heart disease is the nation's #1 killer of women, and experts say a woman in the U.S. dies every 80 seconds from cardiovascular disease. Women's heart attack symptoms can be hard to recognize. They include back pain, jaw pain, nausea, and shortness of breath, but sometimes women are likely to push those symptoms aside.
You know, as women, we tend to have 4 or 5 balls up in the air at one time, and we tend not to get really startled when we have this little difference of a change in how we feel. We tend to pass it off as something else.
Jan Bergelow, a retired registered nurse who spent years working at Camden Clark Medical Center, says we need to go with our intuition if we think something is wrong.
It does happen to runners. It happens to everyone. But you have to be aware of your body at all times. And when something different occurs, follow up.
Nurses and other members of the Camden Clark staff at the event Friday gave the women advice to help keep a healthy heart, encouraging them to exercise daily, manage stress levels, quit smoking, and eat plenty of heart-healthy fats, whole grains, and fresh fruits and vegetables. The Camden Clark team says they are proud of the heart health education they're providing the community.
We are educating, we're raising awareness, we're encouraging and motivating women to take care of themselves, and that is it's a very positive thing that's going on in our community, and that's why we continue to push this information out.
Alexis Robinson, WTAP News, Parkersburg.